Hello students, welcome to EPG Pathshala. I am Rashmi Sinha from Indira Gandhi National Open University. Today we are going to talk on module Body Proportionality in Relation to Age from the paper Physiology and Sports Anthropology. Through this model, we will be able to know about the body proportions, changes in linear growth, changes in body composition and assessment of changing body proportions. In every organism, life begins in the form of a single cell, be it sperm or ovum, eventually changing into a whole new and complex organism consisting of millions and billions of cells. This process of metamorphosis from single and simple being to a multicellular and complex organism, along with all those events which simultaneously take place, leading to changes and development of functions from the beginning till the end of life, is the main focus of growth studies. All these events are not just genetically drawn but are also equally influenced by the environment. Body undergoes several changes with age, whereby each and every part from nail, hair, skin to the bones, heart, lungs transform majorly as a result of lifestyle factors, which are the exercise, smoking, drinking, diet, etc. Growth, a process whereby body undergoes changes in terms of cell quality, quantity, functionality, can be assessed physically by means of two very common and simple measurements: stature, which is also height, and body weight. The two are most common parameters which can not only be used for evaluating the rate of growth but also rate of senescence over a period of time. Increase in stature ceases at about 16 years of age in girls and at 18 years in boys. Body weight increases linearly with age during childhood. Height and weight are the two body dimensions most commonly used to monitor the growth of children and adolescents. Body weight is the most often partitioned into lean and fat components. Body weight equals fat-free mass plus fat mass. Fat-free mass includes skeletal muscle, bone, other connective tissue, body organs and water, whereas the fat mass includes subcutaneous, that is the fat which is beneath our skin, and the visceral fat, the internal adipose tissues. Most body dimensions except subcutaneous adipose tissue and dimensions of head and face follow the same general pattern of growth in size attained and rate of growth as do stature and weight. Pace of growth is rapid during infancy and childhood, which gradually slows down and becomes steady during mid-childhood. It again reaches its peaks during adolescent growth spurt and terminating finally in the adult stage. At the most, changes in body dimensions take their final turn by 20 years of age and rarely after that. Difference in intensity and timing of growth spurts bring about the major changes in specific body dimensions. Changes in linear growth. Length or height in normal term infant increases about 30% by the age of 5 months and more than 50% by the age of 12 months. Infants typically grow about 10 inches during the first year, and height at 5 years is about double the birth length. During childhood, legs are about one-third the length of the body at birth and one-half in the adult. Because the body proportions change, this means that not all the body segments grow by the same amount. There is a steady linear decrease in the relative sitting from 3 to 11 years as the legs grow more rapidly than the trunk. There is also a relative increase in shoulder breadth relative to hip over the same period. In the beginning of the adolescent growth spurt, lower extremities grow rapidly while the sitting height component increases later. Moreover, growth in leg length terminates earlier than sitting height or truncal height, which continues till late adolescence. Thus, the increase in sitting height occurs over a longer period of time and contributes more to adolescent gain in stature than leg length. Increase in the biacromial and bicrystal breadth is another characteristic of the adolescent growth spurt, whereby the shoulder width and the truncal width changes and increase to a great extent, after which no major changes occur across the whole lifetime. These dimensions describe the postcranial shape of the body, depicting the relative growth of the trunk, extremities, shoulder, and pelvic girdles. There are clear changing relationships with age in both the sexes. Changes in body weight. Normal term neonates generally lose 5 to 8% of birth weight in the days after delivery, but regain their birth weight within 2 weeks. They then gain 14 to 28 grams per day until 3 months, then 4,000 grams between 3rd and 12th months, doubling their birth weight by the 5th month, tripling it by 12 months, and almost quadrupling it by 2nd year. Between the age of 2 years and puberty, weight increases 2 kilos per year. In general, boys are heavier and taller than girls when growth is complete because boys have longer prepubertal growth period, increased peak velocity during the pubertal growth spurt, and a longer growth spurt. Changes in circumferences. Pattern of growth of arm and calf circumferences is similar to that of body weight. It is due to the fact that limb circumferences are composed of soft tissues, muscles and fat, which are ultimately associated with the weight of the body. Head circumference shows rapid growth from birth to 2 years of age and then slower growth thereafter. Head circumferences reflect brain size and is routinely measured up to 2 years. At birth, the brain is 25% of adult size and the head circumference averages 35 cm. Head circumference increases an average 1 cm per month during the first year. Growth is more rapid in the first 8 months, and by 12th month, the brain has completed half its postnatal growth and is 75% of adult size. Head circumference increases 3.5 cm over the next 2 years. The brain is 80% of adult size by the age 3 year and 90% by the age 7 year. This pattern of rapid growth early in postnatal life is characteristic of the pattern of growth in brain weight, after which growth in head circumference continues at a slower pace. As expected, a slight but clearly notable spurt occurs during adolescence. Changes in body composition. The body structure hence formed is actually a result of several components: the bones, muscles, fat, and water. Now we'll deal each of them. Bones. Changes in bone tissues can be considered at 2 levels. First, as the growth in the skeletal component, and second, as the changes in the composition of bone tissue. Growth of a long bone is mainly reflected in the height of an individual. Width of a bone also increases as it grows in length. Except for a few bones, all bones of the skeleton change their length and width as they grow. Mineral component in the bone tissue is an important feature of body composition. Sex differences in bone mineral component are minor during childhood but become magnified during adolescence. Apart from this, bone mineral accretion continues throughout the adolescence till mid-20s. Muscles. Muscle fibers, which form the largest tissue mass in the body, begin to differentiate during the second half of gestation. The process continues in the first month of postnatal life. By about 1 year of age, little difference remains in the relative fiber distribution in the muscle tissue of children and adults. Postnatal growth in girth of muscle takes place mainly due to increase in the volume of cells, which is called hypertrophy, and not because of increase in cell number, which is hyperplasia. Postnatally, muscle fibers increase in diameter with age and body size. During infancy and childhood, muscle fibers of boys and girls do not consistently differ in diameter, and adult diameters are attained in late adolescence. The same trend is seen for the muscle mass, which continues to increase from late adolescence to mid-20s. Fat. Fat cells, also called adipocytes, increase in size as well as in number from birth through childhood and adolescence into young adulthood. Children accumulate proportionally more subcutaneous fat on the extremities than on the trunk from infancy to about 5 to 6 years. Then, proportionally, more subcutaneous fat accumulates gradually on the trunk until adolescence. Males accumulate proportionately more subcutaneous adipose tissue in the trunk region during adolescence than females. Females, on the other hand, accumulate more fat in hip region than the male during the same period. Sex difference in visceral adiposity appear to occur during late adolescence when males accumulate proportionally more visceral fat than females. Differences among and between individuals are mainly associated with hormonal levels and metabolic properties of these cells. Changes in these components that form the relative proportion of weight generally vary with age, even if there is no overall change in body mass. Major changes in body composition, specifically fat-free mass and fat mass, occur during childhood and especially in adolescence when major sex differences are established. Generally, fat mass increase and muscle mass or lean mass or fat-free mass and mineral bone density decreases with age. Changes in body proportion at birth. In the beginning, babies have enormous heads in relation to the size of their bodies. As a child grows and becomes taller, his body proportions change. The limbs and the trunk grow steadily, but the head does not grow much bigger. A baby's torso and limbs grow around 25 centimeters taller in the first year. During childhood, growth is usually around 6 centimeters per year. A newborn baby's head makes up less than 1/4 of baby's total length. In this stage, legs and arms are nearly the same length. Babies are still in the fetal position most of the times. Hence, legs are not counted when we say that baby's total length is about 2.5 heads. That's why a newborn's head appears to be disproportionately large as compared to the body. By 3 months, the proportions may not have changed much, but body is noticeably chubbier, and as the legs unfold, they increase the feel of the dramatic growth. If held up, a 10-month-old would look close enough to a toddler but with definite baby features such as lack of neck. Toddlers. By the age of 2, the head makes up more than quarter of total body height. Toddlers are the littlest people that can stand upright like the rest of us. The head is still very large for the body. The legs are short, a little over third of the total height as opposed to half for an adult, and there is beginning of a neck. Childhood. Now let us understand what happens in the childhood. By the age of 6, the head is much more in proportion. Growth is, of course, continuous during childhood. Children in this age can look skinny because the baby fat is gone, even in cases where puberty later brings lot of weight gain. Note that the slim neck grows out of a nearly horizontal shoulder line and neck muscles are not developed. By the 10th year, the head is just over 1/6 of the total body weight. Adolescence. Finally, the head is only about 1/8 of the body length during the adult stage and for the rest of the life. Up till this stage, boys and girls are not differentiated because sexual dimorphism doesn't really appear until then. We only know the sex of younger children because of the way we dress them and cut their hair, but it's very easy at that age to confuse the observer. Puberty is the time of life when hormones reach their peak and make the body mature. Women start puberty earlier, between 8 to 13 years, while men start between 9.5 to 14 years. On a structured level, the difference between waist and hip size increases as fat may increase in stomach, buttocks and legs. There is an increased volume in this whole block. That is the sign of fully grown woman. A boy's shoulders broaden. Adulthood. The next stage of growth is early adulthood, where the final proportions set in. The structure no longer changes and remains same throughout the life, except for the fact that in very old age the bones start losing mass, so there is loss of height and the body may slump, making the neck look shorter and arms fall lower. Assessment of changing body proportion. The progressive development of adult proportions from the fetus to the adults may be viewed as a series of shapes characteristic of various ages and developmental stages. It may also be seen as a set of differing rates of growth. It is clear that relative to other body segments, that lower extremity grows more rapidly and the height of the head less rapidly. The differences in growth rates are responsible for changing shapes and proportion. The most commonly used dimensions to reflect changing shapes are height stature. This is crown heel length below 2 years of age. Sitting height. This is the crown rump length used below 2 years of age. Leg length, which is measured by height minus the sitting height. Biacromial breadth is also the shoulder broadness, and bicristal breadth is the hip broadness. Relative sitting height compared to the stature and shoulder hip ratio is the relative ratio between the biacromial breadth and the bicristal breadth. Although the growth patterns are similar to that of stature and weight for most of the dimensions, but the rate of growth varies among specific dimensions. Such changes are responsible for variations in body proportions during growth. Such a growth where systematic relationship between body dimensions is shown as the growth is known as allometric growth, expressing the size of one's dimension relative to the other indicates the relative proportions of the two dimensions. The two most widely used ratios which contribute to the understanding of allometric growth, sex differences, and impact of adolescent growth spurt on the body proportion are the sitting height stature ratio and biacromial ratio. Sitting height stature ratio, let's see what's that. The ratio of sitting height to stature is an index of relative contribution of trunk and by subtraction the lower extremities to stature. The ratio is the highest in infancy and declines through childhood to adolescence. It is lowest during adolescence growth spurt and the increases into late adolescence. During infancy and childhood, the lower extremities grow faster than the trunk. As a result, sitting height contributes less to the stature with age and the ratio declines. The ratio continues to decline and reaches its lowest point early in adolescent spurt because the legs experience their growth spurt earlier than the trunk. The growth spurt in the trunk follows that of the legs and the ratio increases. Hence, the increase in the ratio in late adolescence indicates the late growth in the trunk length at a time when growth in the length of the lower extremities had already ceased. Now, what is bicrystal biacromial ratio? Broadening of shoulders relative to hips is characteristic of adolescence, and the broadening of hips relative to shoulders is characteristic of female adolescence. The ratio of bicrystal to biacromial breadth indicates the differential growth of these two trunk dimensions during childhood and adolescence. Bicrystal breadth constitutes a greater percentage of biacromial breadth in girls than in boys, and thus girls have broader hips relative to their shoulders. Differential growth during adolescence contributes to the sex difference in the proportional relationship of the shoulders and hips at this time, which continues into adulthood. Let us summarize what we have learned in this module. Growth, a process whereby body undergoes changes in terms of cell quality, quantity, functionality, can be assessed physically by means of two very common and simple measurements: stature or height and body weight. These two are the most common parameters which can not only be used for evaluating the rate of growth but also the rate of senescence over a period of time. Increase in stature ceases at about 16 years of age in girls and at about 18 years in boys. Body weight increases linearly with age during childhood. Height and weight are the two body dimensions most commonly used to monitor the growth of children and adolescents. Length or height in normal term infants increases about 30% by the age of 5 months and more than 50% by the age of 12 months, that is 1 year. Infants typically grow about 10 inches during the first year, and height at 5 years is about double the birth length. During childhood, legs are about 1/3 of the length of the body at birth and 1/2 in the adult. The progressive development of adult proportion from the fetus to adult may be viewed as a series of shape characteristics of various ages and developmental stages. It may also be seen as a set of differing rates of growth. Thank you.